Hi guys, it's Nurse Williams. Thanks for visiting my channel. Today we're going to talk about medication errors, which is the most critical thing in nursing. So if you guys are not familiar with the RaDonda Vault story, this is a former nurse who was practicing at Vanderbilt Hospital in Tennessee. She accidentally gave a patient Vecuronium, which is a paralytic drug, instead of Versed, which she was supposed to be given. However, because of this medication error, this patient ended up dying. And so this was an outrage all across the nation, all across the world, basically about, it was like halfway divided. Some people were on her side, some people were against her. Me as a nurse myself, working in the emergency room where there is always chaos everywhere, almost all the time, this really hits home because I'm sure her intention was not to kill this patient, but it lets you know that there are certain protocols in the hospitals that should be in place that are not in place, that should be able to stop a nurse from grabbing the wrong medication, even if she has to override the button. However, many institutions are not set up like that. I'm not quite sure what hospitals have done since this has happened. I know for my hospital, you're still able to override certain medications, and we have actually stopped nurses before giving the wrong medication because we have multiple nurses checking, which is another safety tip that should be in place. You should always have a 2-person verifier with any kind of medicine that you're giving. But anyway, back to Miss RaDonda Vault. Her nursing license was revoked. She was facing jail time, I think up to maybe 12 to 17 years. I'm not exactly sure. However, her sentences was reduced tremendously down to only 3 years of probation, which is really good. I do feel for her because I feel like she should have, been able to step back into her nursing role. But this is what I want you guys to understand about medication errors. They're so critical. And even if, your patient does not die, even if they don't have anything, severe that happens, they could have. And you have to be sure that even if you're in a rush, so guys, you have to slow down. You have to ask yourself, is this worth me making a mistake, causing, something serious to happen to this patient? And sometimes you have to let doctors know that I'm taking my time with this. I want to make sure I got the right medication. Those couple of seconds and you verifying that you have the right medication is not going to, hurt you. It's going to help you in the long run. So always remember, especially to my nursing students who are going out in the field and current nurses, always double check your meds. Even if you think you have checked it, check it once more and have another nurse verify it before you push that medication, because a lot of these drugs that they're making now, they look alike, they sound alike, and sometimes they even come in the same color. And if you're in the rush because you're in a code or you have, something going on, this patient needs this medication really quick, you're going to hurt them more if you give them the wrong medication and it kills them. So always slow down. Always take your time. No matter who's rushing you or who's not rushing you, you have to think, this is my nursing license. I am here to protect this thing to the end. And you have to make sure that you are doing your part. CYA, cover your ASS, basically. And always do that. I don't care if it's Tylenol. I don't care if it's Versed. I don't care if it's, fentanyl, whatever it is. Double check your meds. It is not going to hurt you. It's going to help you. This last little clip that I added on was her sentencing from the Board of Nursing, where they revoked her license, and they would not let her get her license reinstated. I'm hoping in the long run, I am very hopeful for her. I can tell that she loves nursing, that it was a part of her that, will forever be. I'm hoping that in the long run, they will let her be reinstated so that she can practice again. I'm sure she will not make the same mistake twice, but I encourage you nurses, new nurses, whatever, try not to make this mistake. I know that medication errors happen. I know that we all get so caught up in what we're doing and we skip over steps, but you can't skip over steps. You cannot skip over steps. I've gotten so comfortable with telling people, you're going to have to wait a second. You're going to have to give me a minute. I want to make sure I got this right. I don't care if it takes me extra 10 seconds. It's going to be extra 10 seconds that I've checked and I've verified each medication, each IV fluid, whatever, each procedure. I am verifying everything because I don't want to lose my license. I don't want to go to jail. I don't want to hurt a patient. I don't want to hurt their family. So just be cautious. Just be careful, y'all. And I want you guys to always remember, and I'm going to say it again. I'm going to keep saying it. Those extra seconds that it takes for you to verify your medication, your IV fluids, whatever, it is not going to hurt you. It's going to help you in the long run. Y'all have an amazing day.